We'll be diving into the world of immunohistochemistry with a focus on the thyroid stimulating hormone, or TSH, test. If you're new here, don't forget to subscribe and hit the bell icon to stay updated with all our latest content. Now, let's get started. Pre-test information. Before conducting a TSH immunohistochemistry test, there are a few crucial pieces of information that are required. Histopathology report. It is essential to provide a copy of the patient's histopathology report. This report helps the pathologist understand the context and specifics of the tissue sample. Site of biopsy. The exact site of the biopsy must be documented. Knowing the source of the tissue sample is crucial for accurate interpretation and diagnosis. Clinical history. A comprehensive clinical history of the patient is also necessary. This includes any relevant symptoms, medical conditions, or previous treatments that may affect the interpretation of the test results. Specification of the TSH test. So, what exactly is the TSH test in immunohistochemistry? Let's break it down. Thyroid Stimulating Hormone, TSH, is secreted by thyrotroph cells located in the anterior pituitary gland. While TSH plays a crucial role in regulating thyroid function, pure TSH-secreting adenomas are quite rare. Interestingly, about 30% of these cases are associated with prolactin secretion and may even be plurihormonal, meaning they can secrete more than one type of hormone. This makes the TSH test particularly useful in the classification of pituitary adenomas. It helps pathologists differentiate between different types of tumors and their hormonal profiles. Diseases associated with TSH. Now let's talk about the diseases associated with TSH. The primary conditions related to abnormal TSH levels involve the pituitary gland and the thyroid gland. Pituitary adenomas. These are benign tumors of the pituitary gland that can secrete TSH. The TSH test is instrumental in identifying these adenomas, especially when they secrete multiple hormones. Thyroid dysfunction. Abnormal TSH levels can also indicate thyroid dysfunctions, such as hypothyroidism or hyperthyroidism, which are conditions involving underactive or overactive thyroid glands, respectively. Specimen used in TSH test. The next crucial aspect is the specimen used in the TSH test. The specimen typically involves a biopsy sample from the pituitary gland. This could be a small tissue sample obtained through a surgical procedure or a needle biopsy. Accurate handling and preservation of the tissue are essential to ensure the reliability of the immunohistochemical staining and subsequent analysis. Components included in the test. So, what are the components included in the TSH test? The test primarily includes antibodies specific to TSH. These antibodies bind to TSH molecules present in the tissue sample, allowing pathologists to visualize and identify the presence of TSH under a microscope. In some cases, the test may also involve markers for other hormones, such as prolactin, to identify plurihormonal adenomas. Test report time. How long does it take to get the results? The test report time for a TSH immunohistochemistry test is typically 7 days. This period includes the time required for processing the tissue sample, performing the staining, and interpreting the results. Additional test information. To wrap things up, here's some additional information about the TSH test. TSH secretion by the pituitary gland is a critical factor in maintaining normal thyroid function. However, when abnormalities occur, such as in the case of adenomas, TSH secretion can become dysregulated. The TSH immunohistochemistry test is not only valuable for diagnosing pituitary adenomas, but also plays a role in guiding treatment decisions, as it helps determine the tumor's hormonal profile and potential behavior.